This is critically important now because we're experiencing critical shortages in our health human resources.
With news that Ontario is looking to deploy internationally trained nurses across the province, hospitals have already started recruiting, hoping that this untapped resource can be the answer to the nursing shortage.
We had that back then, so so that it would have been easier for nurses.
Chandra Kafle worked as a nurse in Nepal for almost 8 years. When she moved to Canada in 2012, she hoped to continue her career. She says it took almost 3 years just for her application to be denied.
At that time, it was really tough.
It would take years, but Chandra succeeded, landing an RN job at Sunnybrook, where she also completed her clinical placement, all while supporting her family.
I think many nurses who came at that time, same story, same struggle, but now looks like it's way faster.
Join us because we make impossible possible here at Sunnybrook.
This is a new recruitment video calling on internationally trained nurses to come work at Sunnybrook.
We hear stories from our internationally educated nurses that there are a number of barriers, and the barriers create long gaps within each step that they experience.
Sunnybrook, along with regulators and the healthcare system, are working to remove these barriers. And through funding, they are able to create new non-nursing positions so applicants can get a foot in the door.
They are almost like the precursor. So it means that internationally educated nurses can work within external roles to start to work within healthcare teams, to start to care for patients in hospital roles, and they can start to culturally integrate.
The applicants will be matched with mentors, teachers, teams. Opportunities will be provided in a systemic and coordinated way within the healthcare system.
What we're really trying to do is work together to create successful transitions, to ensure that we're able to provide opportunities for internationally educated nurses to become professionals in the Canadian healthcare system.
They say this will shorten the process for IENs, and they're expecting thousands to move through the healthcare system.
Please do not lose hope. There are days you feel like giving up. You feel like it doesn't worth it. I might go back home. You are here for a reason.
Now, one group of internationally trained nurses have already moved into these newly created roles, Sunnybrook adding that they will continue to monitor for any improvements. In Toronto, I'm Faiza Amin for City News.